Welcome back, everybody. Listen, Medicare is really complicated and confusing, but not if you let a Univera representative help you with it. This morning, we've got April Romanowski back to share some common questions that they get all the time that they can help you with. And listen, April, I got to tell you, you're star of that commercial. And I think they picked the right person. You do a great job.
Thank you.
Let's start with, what are people most confused about?
Oh, that's really a loaded question, because there are so many things that people can be confused about. What do I do?
Yeah.
I have Medicare. What do I do? I am taking all of these medications. What's the best plan for me? And I think now prescription questions are the biggest question that I get. I'm taking this. It's very expensive. How can you help me cover it?
And that is a big question. I mean, the costs of those prescriptions can be very, very scary.
They can be.
Yeah. All right, we'll get back to that in a second. What if people are facing new challenges?
Anything can happen. I don't have a crystal ball. I can't tell you what's going to happen tomorrow, let alone a year from now. So we're there to help people if they have a catastrophic situation. Maybe they're not on the right plan that they need to be on. We're there to help find that right plan, to find a way to be able to change them, because there are opportunities to change plans throughout the year.
That's good to know. So if something does happen and you do have a change, it's not a one and done thing. You can go back and call your Univera rep after you've signed up for something, and they can give you, continual information on what it is you can do.
Right.
That's fantastic. People are not alone. We just talked about prescriptions. Let's get back to that for a second. There's been a lot of news about the rising prescription drug costs. Any advice that you can give people who are on a fixed income?
Really, we try to get people to look into getting generic medications. It may not be appropriate for everyone, and that's something you do need to talk to your doctor about, because I am not a pharmacist, I am not a doctor, I don't know. But there are a number of generic medications out there that will do the same thing that your brands, and that will save you a lot of money. There are programs out there, one of them being a New York State prescription program called EPIC, which many people in our community qualify for.
Okay. Is that the same as getting the Medicare Advantage plan?
No. Medicare Advantage is going to be a type of plan that's offered throughout Western New York. It's a very affordable plan. It covers a lot of medications. With Univera, we have all of our plans give you $0 generic copays.
Oh, that's great.
So it's a great way to look at affordability.
And now you can see why you need that Univera rep in your corner, because there are a lot of different plans to choose from, and this way you can sit down with someone, go through it slowly, and find out what's best for you. And I also see in the paper you are having Medicare Seminars. So what can people expect if they go to one?
We are having a lot of seminars. We are this coming year, going to have some excellent products available for our Medicare members. So we want you to come to a seminar. We want you to learn about all those different plans that we're offering, and anything that we can help to make it an easier process for you.
Right, because April, a lot of people are on company-sponsored health plans. They've just retired, and now they're thinking, okay, this is the first time I've actually had to think about this. So this is when you want to go ahead and call Univera and get the rep to sit down with you, work through it, and find out it's not so scary after all.
It's not so scary.
You can do it. You can do it too. Listen, we want to thank April for seminar information. All you have to do is go to univeraformedicare.com. They also have a great toll-free number that you can call, or you can also go to univeramedicare.com.